80,000 people in this country will be diagnosed with a brain tumor this year. It's important to know the warning signs, too. Joining us with more today is Director of the Brain Tumor Program with Hartford Healthcare's Air Neuroscience Institute at the Hospital of Central Connecticut, Dr. Nazer Qureshi. Doctor, thank you for being with us today. We appreciate it.
Thank you for having me.
All right, there are two categories of brain tumors. Explain to us what those are.
There is no other diagnosis in medical literature that creates a fear and panic in one's system as brain tumor. But let me tell you, the brain tumors are not alike. There are benign brain tumors that sometimes require nothing except observation or at most surgery. The others, however, are malignant tumors and require treatment plans. Those can be further subdivided into primary brain tumors that arise from the brain itself, or the secondary ones that arise from elsewhere, such as breast or lung, and then go to the brain. Brain tumors can happen anytime, from childhood to adult life.
Okay, what are some of the symptoms that could indicate that you have a brain tumor?
Some of the symptoms you cannot ignore, such as someone having a seizure when they do not have an epilepsy, or not being able to use one side of the body compared to the other, or difficulty speaking or thinking. Sometimes the symptoms may be very mundane and could be missed, such as the headache. But I tell my patients, if you're having headaches at the beginning of the day after having a full night's rest, and this consistently is happening, then you need to see a physician. Similarly, sometimes behavioral changes and personality changes, but that a person cannot pick themselves, and that's where the family comes into play, that if something is amiss, they need to go and see a physician.
So someone comes to you, how do you make a brain tumor diagnosis?
As with any diagnosis, first it starts with listening to the patient, doing a thorough clinical and neurological examination, and then based on your suspicion, you send them for a CT scan or an MRI of the brain with contrast, and you go from there. Once you do the surgery, the final diagnosis depends on pathology when you send it to a pathologist, and then they can do the further testing to help us diagnose, characterize, and make a treatment plan based on the diagnosis.
Okay, so you have the diagnosis. Then what are your treatment options, and tell me about the outcomes you're seeing now with these patients?
The treatment options are great. For benign tumors, sometimes, as I mentioned, you don't even need to do any surgery, but if you do surgery, they come out okay, and then they keep on living their long life, productive, fruitful life. Malignant tumors require a team approach with chemotherapy, radiation therapy, and there are other physicians involved in it, and those patients also continue to follow with us time to time, months apart, so that we can change the plan if we need to.
Dr. Nazer Qureshi, we appreciate your time today. Thanks for joining us.
Thank you.